Unless you are one of Canada's first peoples who crossed into North America over 10,000 years ago, your ancestors will have a much more recent story of how they came to Canada. And it will be a story of pluck and luck, hard times, good fortune, really telling how your family became a family tree. And so today I'm going to talk about Echo Ontario's migration story. Now, I think I'm better with that. If you just push it for me. Yeah, thank you. So in the spirit of full disclosure, I do need to tell you that I gave an earlier version of this talk last year to the international Meta-Echo community in New Mexico. And at that time, I told people about my patient, Martin. He's so proud that I'm showing this picture today because it's thanks to Martin, his low back pain experience, his refugee experience, that really inspired me to learn more about chronic pain management. And thanks for the next slide. So I also told people about Kingston and obviously showed them Old Fort Henry, and then also told him Don Cherry. He lives on Wolf Island with Paul Tainser. But I did neglect to mention one really important set of Kingston icons, and I'm going to talk about them today. So that would be Kingston's Boys, the Tragically Hip. Okay, and why they're relevant to Echo. So that can stay actually right there. I want you to look at them. They were young men. I was not the first Canadian to find Echo. So it's really important that you know Dr. Jordan Feld, a University of Toronto liver specialist, discovered Echo in 2009. And he flew down to New Mexico and met with Dr. Aurora, came back to Canada with the plan of running a hepatitis C Echo in Ontario. And unfortunately at that time, the ground was not yet prepared. So his beautiful Echo seed failed to germinate. So isn't it just absolutely fabulous that Jordan and his colleague, Dr. Hemant Shah, are now running an Echo Ontario for hepatitis C. And alongside Dr. Claire Bombardier and Amanda Simon, who are running an Echo rheumatology. And I haven't forgotten to mention our friends at CAMH, whose mental health and addictions Echo has been running for at least a year and a half. Thank you for being early adopters. Thank you. So I really don't like to tell this story, but it terrifies me how close I came to never finding Project Echo. I was at a pain conference in 2012, and I walked right past a talk being given on something called Project Echo, Chronic Pain, Opioid Stewardship. Or no, that's our name, chronic pain. Theirs was chronic pain and headache. Anyway, I walked right past it, but they had a booth at the conference, and I stopped to talk to them. And I just thought, this is the most amazing model in the world. I flew back up to Canada, and everybody I told about it just shrugged. But not Andrea Ferlin. Not Andrea Ferlin. And if it weren't for Andrea, she got it right away. And, you know, thanks to Andrea and University Health Network, we had the legs to get Echo off the ground. Okay. So we were lucky, though, because our ground had been prepared by then. And prepared by Dr. Angela Malis, who many of you know. This lady here, she'd been lobbying at the Ministry of Health for some time for better access to safe and effective pain management treatments. And you don't say no to Dr. Malis, you may know that. And she'd been speaking with Dr. Gary Salisbury, who is here in the room. He was a Kingston family physician, but he also, and then he went on to move to the ministry, but he also saw value in the Echo project. So here we are when the demonstration project for Echo Ontario Chronic Pain Opioid Stewardship was announced in April 2014 by then Minister of Health, the Honourable Deb Matthews. And I see that that was really, that happened at a very opportune time because of all of the sad stories we now have about opiates and overdose deaths. And really what we're doing is trying to mitigate the terrible low amount of education that's given to primary care providers about chronic pain. You know, veterinarians in Canada get more than 5 times that pay and education given to healthcare providers, and less than 20 times that given to most family medicine residents, who really end up with one tool in their pockets, and that's the prescription pad. And you know where that has gotten us. So back to the hip. The boys went to the same high school I did. There you go. However, next one, thanks. It would be at least a decade or more since I graduated. But I know their fathers, and we see them out and about in Kingston, and we're typical Canadians. We just leave them be. We don't bug them, no requests for autographs or anything. And you will know that the HIP's lead singer, Gord Downey, was diagnosed with terminal brain cancer last spring. And after he finished his treatments, they planned one last tour. They started in British Columbia, and they ended in Kingston. And tickets ran out within minutes. But the CBC came to our rescue, and they erected a giant screen in Kingston's Market Square where 25,000 fans came together to hear the HIP's last concert. So where else but in Canada would you run into our Prime Minister in the square taking a selfie with my colleague, Dr. Erin Beattie? She's a huge HIP fan. That shows us something about Justin, doesn't it? It does. So that night, Gord spoke directly to Prime Minister Trudeau in his concert, in his final concert, speaking to him about the plight of Canada's First Peoples. And he asked him for help. He spoke about, you know, there's intergenerational trauma, the poverty, and the suicides, and the despair. And yet already Dr. Alison Crawford from CAMH has started a First Nations, Inuit, and Métis wellness echo. Amazing. So echo's here for our most vulnerable and underserved populations. And Whip Lambov, for example, you started a community mental health worker echo for people who work with Toronto's underserved and addicted populations, our homeless people. CHEO, for example, you just launched your child and youth mental health echo. And Toronto Sick Kids, you have 4 topic areas that you want to share with primary care providers who care for children and adolescents. So this is amazing. Echo is also about inspiration, altruism, and empowerment, not only for healthcare providers, but also for patients. And it's about ensuring that every Ontarian gets access to best practice care, no matter where they live, and that care takes place in the patient's medical home, the primary care provider's office. So Dr. Aurora has asked every echo to help him reach 1 billion people by the year 2025. And I think echo can help with that. We know Gord won't be with us forever, but we do know that his legacy will live on in his Secret Path movement, which tells the story of 12-year-old Cheney Wenchak, who was from the Anishinaabe First Nations on the Albany River in Northern Ontario. And in 1966, Cheney froze to death while walking the hundreds of miles home from a residential school in Kenora. So just imagine if every one of those 25,000 people in Kingston's Market Square were there because they wanted to start an echo. In 2013, when we had our first echo meeting, I think there were 5 people in the room. And you guys know who you are, who you were, who was there back then. And now it takes this whole big room to house you all. I'm just so proud to be here today and to know that you're willing to help. Thank you.